Dr. Hutber is with the American College of Sports Medicine and Vice President of the Exercises Medicine Initiative, and we're very happy to have him here. He came in from Indiana this morning, and fortunately, the flight was on time. So I'm going to let him tell you about the Exercises Medicine Initiative.
Thank you, Paula. Well, good afternoon, everybody. It's a pleasure to be here. Thank you for inviting me, and thank you for inviting me to talk at the college. As I look around here, is it true then that the ladies are more interested in physical activity in the college than the guys? We've got some work to do there. Well, on behalf of my gender, I apologise. Okay. Whoops, that's not the one. Let's try. Okay, technical guy, how do I get that off the screen? Thank you. There we go. Today I want to just talk a little bit about exercise as both a treatment and a vaccine. And I'm going to show you a few, because of who you are, you're a bright bunch of people. I'm going to show you some of the medical evidence to really back up what I'm saying, and then translate that into, okay, how do we make this practical, okay? So I'm going to kind of try and run the gamut here of looking at physical activity both as a treatment and as a vaccine for preventing chronic disease. Well, which factors determine how long we live in society? Obviously hereditary, and if you're lucky enough to choose your parents, hands up who did? Nobody? Okay, then you can affect that. Environment, and until the beginning of the century, this was a huge factor in determining how long we live. But now behaviour is the biggest thing we can influence to change our longevity. So we're going to begin by asking ourselves, how important is exercise to health in the treatment and prevention? And I just want to start off by talking about physical activity by itself, not fitness, but physical activity. This is a study of about 1,000 women who had coronary artery disease. And it really asked the question, okay, well, let's look at these women. They've got coronary artery disease. What happens to those that increase or decrease their physical activity? If you look at this, you can see that the baseline on the left-hand side there, that shows the relative risk of dying, and the baseline is 1. So when they started this disease, the baseline is 1. Sorry, when they started the study, the baseline is 1, and you can see that the energy expenditure at 1 is 0. So that's the beginning point. And they followed these women for 9 years. And what you find is that the women who increased their energy expenditure by 2,500 calories per week decreased their risk of dying by almost 50%. Those that decreased their physical activity level by 2,500 kilocalories per week were getting close to doubling it. So just changing the physical activity level in women that had cardiovascular disease was sufficient to cause this huge difference in their death risk over the next 9 years. That by itself. What is the effect of fitness on mortality? This is really the question we get to, not just physical activity, but how fit you are. And you can see a really nice trend here. Those that are unfit, those that are moderately fit, and those that are high fit. We'll talk a little bit about that in a minute. But the trend is, and this is the take-home message, that as you increase your fitness level, you significantly decrease your risk of dying. And you notice the biggest bang for the buck is between going from an unfit person to a moderately fit. That's good news, isn't it? It means that you don't have to put in all the hard work of getting to high fitness level unless you really want to. This is the biggest bang for our buck. If you get moderate fitness, you have a significant decrease in your mortality rate. And I just showed this. These are subjects in the orange who have normal, and the ones in purple have cardiovascular disease. Let's look at the ordinary people first of all. And this is just quintiles of exercise. So it just breaks it down into the more fit we get. We go from here, we're getting fitter, we're getting fitter, we're getting fitter, we're getting fitter, and our risk of death is decreasing the fitter we get. And guess what? It works not only for the normal people in orange, it also works for those with cardiovascular disease. So if you or someone you know or family or friends already has cardiovascular disease, this helps. It helps a lot. You can see, even for people with cardiovascular disease, the fitter you are, decreases your risk of mortality. Colon cancer does the same thing. Cancers, both colon and breast cancer, are significantly impacted by physical activity levels. So this is the same thing with breast cancer. You're going to get bored by the end of this, but if there's one thing I can sear in your brain when you leave, it's increase your physical activity, you're going to see this trend. The trend is decrease your risk of death. And it works for all these diseases. 54% death rate with women with breast cancer who exercise 30 minutes a week 30 minutes a day, 5 days a week. It decreased their death rate. No drugs. Don't run away and say, Adrian says you don't have to have chemotherapy or anything. No, I'm not saying that. I'm saying that this, in addition to everything else, this is a huge, something that we should be taking notice of. If you don't happen to like running, because those were really talking about cardiovascular studies, what happens if you like working out with weights in a gym? Some women do, a lot of guys do. Well, fortunately, you see the same thing. This is, again, mortality rates on the right. As you increase your musculoskeletal fitness, this very familiar curve, from low to moderate to high, you significantly decrease your risk of mortality just by working out, essentially with resistance training, your musculoskeletal fitness. Excuse me. Now, I know no one here is old, but I bet we know old people, right? So what happens as we get old? Is this important to an old person? Because if you think, I'm too old to change, this is okay for the younger people, but you know, my body's been battered by life and it just really doesn't make any effect. Well, guess what? It really does. Let's look at an unhealthy lifestyle. Functional capacities are something we typically talk about, but for an old person, how can we perform all those things we need to do to make life not only do things we need to, but make it interesting, our functional capacity. This is what happens as we age. It goes along and then it starts gradually decreasing. And this part here is often spent in a nursing home. It's called efficient survival, where it's not a pleasant experience for people who are in that situation. Now look what happens for those people if they're physically active and have a low-risk lifestyle, so you're active. What tends to happen is you go along. Unfortunately, it doesn't stop you dying, but you go quickly. Okay? That's the way I want to go out, not like that. So physical activity is really important as we age, and Adrian Hutber said it great. The goal is to die young, but as late as possible. This is a great graph. I want to just bring, it doesn't matter whether you're in your 60s, your 70s, or your 80s, you'll notice the same pattern. Regardless of what decade you're in, as you increase your fitness, you'll decrease your mortality. Now, here's the interesting thing. Look at this. Someone in their 80s who is highly fit, that's their life expectancy or their mortality, risk of death is low. Someone in their 60s who is unfit. Someone in their 80s who is fit is living longer than someone in their 60s who is unfit. So, really important message that's really worth repeating again. Someone in their 60s who's fit lives longer than someone in their 80s who's fit lives longer than someone in their 60s who's unfit. So it's a message to be telling folks that we know that are in either the 60s, 70s or 80s. You can do something about that. Okay, physicians typically say, yes, Adrian, I know that, it looks good, that's kind of interesting, but you know, we like randomized controlled studies, and I get that, we require randomized clinical control evidence, so have you got any of those to show us? Well, there are. Here's where we compare, basically folks had coronary artery disease, and then when they had coronary artery disease, they could get assigned to either an exercise group or an angioplasty group. And look at this one on the left here. This is their event-free survival, so high is good, you want to survive, and you'll see that they had a higher survival rate by exercising than they did by having a surgical intervention, angioplasty. And this was 20 minutes a day on a cycloergometer. It was more effective for these folks with stable coronary artery disease compared to angioplasty, and guess what, it's cheaper. Now, I'm not saying that means that there shouldn't be any cases or we shouldn't do angioplasty. I'm just saying that it's a very effective treatment for coronary artery disease for a certain group of patients, and physicians need to be aware of that. Same thing for clinical depression. Drug therapy and cognitive behavioral therapy produce remission in approximately 40% of patients. And you can see here that that's significant. So if you have at least mild to moderate clinical depression, physical activity has a big effect. Now, something you could say is all this stuff with physical activity is all well and good, but you know what? The reason it works is because it's reducing your body fat. It's reducing your body fat, and it's a reduction in body fat that's giving you all these benefits. Look at this. These are, and this is a really hot topic today, isn't it, obesity? these are three groups: normal weight, overweight, obese. Okay? So the first thing I want to show you is, and this is the cardiovascular mortality, so we want low on here, just like all the other graphs. Doesn't matter which group you're in, whether you're in a normal, overweight or obese group, as you become more physically active, it decreases your mortality rate. And here's something else that's interesting. Look at these obese patients and compare their death rate to somebody who is apparently normal weight, and this person is obese and fit, about half the death rate of somebody who is not obese or skinny and unfit. Okay? Say that again. Somebody who is obese and fit, half the mortality rate of somebody who is skinny and unfit. We need to get off this soapbox about there's an obesity epidemic. Yes, there is, but it's more important to talk about the inactivity epidemic, because that's even more important. I'm going to skip by then. Here's the take-home message. It's better to be fat and fit than skinny and unfit, and that low level of fitness is a bigger risk factor for dying than mild to moderate obesity. Now, this is good news if we're talking to people, if we're talking to whether we're a physician talking to patients, whether we're talking to friends, because guess what? Somebody comes in and they're overweight, they go a bit of physical activity, next week they're on the scales, they weigh the same, they're depressed and they give up. That's not everybody, but a lot of people become demotivated because they can't change their weight quick enough. The thing I tell them is, even though your weight doesn't change immediately, guess what? Your body knows it's exercising, you're getting the physiological benefits, you're getting the prevention and treatment on chronic diseases immediately, and guess what? You will start to lose weight, but that takes time to catch up. So the message that I think we should be giving people is start physical activity, because even though you don't see the weight change immediately, these benefits start to happen. And the weight change is important, but I think it's a byproduct. Now, I said this, and this went down really well on a couple of groups, and then I went before a group that was largely women, kind of like this group, and I said, any questions? And one of the ladies put her hands up, and I said, yes. And she said, Adrian, you just don't get it. So what don't I get? I was now really worried. She said, we want to look good. It's not how we're inside. It's really important for us to look good as well. So I get that. I've now been corrected on that part of it. What I'm telling you is, as well as looking good, you want the chronic disease benefits as well. If you don't remember anything else today, I want you to remember this, the effect of this graph here. How important is it about physical activity compared to all the other things that do us harm? And if a patient goes into a doctor's office and the person has diabetes, high cholesterol, hypertension, smoking, obesity, these are typical risk factors that typically physicians tend to assess. And you'll notice that amongst these, probably, they're the common ones that lead to chronic diseases, all these ones here. The one on the left is low cardiorespiratory fitness. The take-home message here, and this was measured on more than 50,000 men and women over 2 or 3 decades, is the biggest risk factor for all-cause mortality. What's most likely to kill you is low cardiovascular fitness. The only thing that even comes close is hypertension. So according to this data, it's about 8 to 9 times a higher risk factor to have low cardiorespiratory fitness than obesity. It's about double the risk of smoking. It's much higher risk than high cholesterol. It's a much higher risk than diabetes. The only thing that comes close is hypertension. The reason I like this data, it's Steve Blair's lab when he was at the Cooper Institute. And the reason I think this data is so great is because typically when we measure fitness, and some of the World Health Organization data doesn't rank physical activity quite as high or as important as this. So people ask me that sometimes, this data doesn't agree with the World Health Organization, and I said I know, and I put more faith in this. No disrespect to the World Health Organization, because in my opinion, the reason for it is this: what happens in the World Health Organization, you can't measure everyone's fitness all over the world, you do survey data. Steve Blair and his colleagues here measured these on the treadmill. They actually knew their fitness. And we know from other data work, when you actually ask people, are you fit, Mrs. Jones? Are you fit, Mr. Smith? About 40 to 50% say, yes, I am. You put an accelerometer on them and measure them, and 5% are. So you get a massive over-reporting of fitness. When you actually measure them, physical inactivity is far more important than we think it is. And this data shows that. Okay, Now, what about treating disease? There's a study came out in the CDC that says walking dogs is good for your health, and this guy read that study, but he got the wrong end of the stick. It is good for your health, but not for the reasons he's portraying here. How does physical activity affect your likelihood of even contracting a disease in the first place? The ones we most likely think about. Hypertension, same thing. I'm going to quickly scoot through these. More fit you are, the less likely to become hypertense. Same thing, type 2 diabetes. The more fit, the less likely you are to get diabetes. This is the likelihood on the left here. Incidentally, this is comparing physical activity with the typical diabetic drug metformin. Physical activity in this study is twice as effective in preventing diabetes as the drug was, metformin. Cardiorespiratory fitness and risk of dementia. So Alzheimer's, my mother died of Alzheimer's, so this is particularly meaningful to me. The fitter you are, the less likely you are to get dementia. Massive decrease here, about 50 to 60% decrease just by being moderately fit for contracting dementia, Alzheimer's disease. So, here's a summary slide telling you basically the things here. I'll let you read those for yourself, but there's a, yeah.
Can you go back to the last one?
Yeah.
How come it goes up at high? Fitness, it goes up a little.
You mean here?
Yeah.
Yeah, I suspect if we had the error bars on there, there'd be no statistical difference. So I didn't put the error bars on. I don't think there's any difference. I think the message is it doesn't really make any difference going from moderately fit to high fit. So the intensity there is not really helping. Okay, so all the diseases, the common chronic diseases that we have today in society, physical activity has a huge impact on all of those. And the healthcare costs as well. Here's a graph showing approximately 27% lower healthcare costs for folks that were physically active compared to those that were physically inactive. So reduced healthcare costs, it's something we need to be paying attention to, not just for health reasons, but for economic reasons as well. Summary of current scientific knowledge. Again, the benefits can't be denied, and there's overwhelming evidence that physical activity is a public health burden. So the question to ask is, okay, Adrian, I'm convinced, you've convinced me, so how much do I need to do? How much is enough? How much exercise do I need to actually do? Well, we tend to think of physical activity for performance, and I love sports. We love watching it on TV. That's great. Some people do it for fitness, and so some of us work out, whether it's in a gym, whether it's outside, and that's great too. And society has tended to concentrate on these two buckets, and we've ignored this one. And there's a continuum of exercise you need depending on what your goal is. So the goal for this and the amount you need is not the same as the goal you need for that. So I'm going to talk a little bit about what goal you need to get this effective, even if you don't care about fitness, even if you don't care about being an athlete. Because reality is, although a few of us maybe care about that, most of us just don't. And I won't spend much time on this, but basically the take-home message there is that the FIT principle talks about the sort of the intensity, the duration, the amount of physical activity you need in terms of intensity and duration, how many times a week. I'm not going to go into the differences there. I'm just going to end up just tell you what you need to avoid disease. But I just want to bring your attention to something here. I want you to think of this is percentage of benefit you can get, and heart rate and VO2 max are both indicators of fitness level. And there's your blood pressure, and there's the HDL, so we obviously want a high HDL for fitness. And you can see that the sweet spot for the amount of exercise we need to get the maximum benefit on all these parameters here is about here, right? You all see that, where the graphs tend to top off? All of those tend to, so about here is where we want to shoot. And that works out about 150 minutes a week for all of those parameters. That's about the amount we need to get in all those effects. And same thing here, and I'll just point out one other thing. Again, the gains in fitness was this VO2 max, and it's as you increase your amount you exercise a day, it tends to level off. So we want to be somewhere over this hump here. We want to be in this area of the curve. But then you can ask the question, well, what about increased risk? How about, am I more likely to have a problem by exercising? Well, here's the problems you can get with physical activity from either orthopedic problems or heart problems. As you increase the amount, it starts to go up. So, but look at this spot here where the problems haven't gone up, but the benefits are maximum. And again, you'll see that the duration you need is about, you can see minutes a day, about 20 to 30 minutes a day, which translates out to this about 150 minutes a week. So, in 2008, the US government came out with the first federal physical activity guidelines. And the take-home message is, to prevent and treat chronic disease, you need about 150 minutes a week of moderate physical activity. That's the thing to remember. The easiest way to remember that is moderate is at such a level that you could still carry on a conversation, but you're not working so lightly that you could sing. And there's added benefits, obviously. You don't want the person next to you singing unless they have to be great. So, the sing-talk test. Still speak whole sentences, but you can't sing. That's the moderate level. If someone says to you, well, you know what, I don't have 150 minutes a week, good grief, that's 30 minutes a day, 5 days a week, I just don't have that. Well, my message to them would be, exercise on the weekends then. 75 minutes a week on Saturday, 75 minutes a week on Sunday gives you the same benefits. It doesn't have to be 30 minutes a day, 5 days a week. We used to recommend that, and we still do recommend it, just because it's better for changing habits to do it 5 days a week than twice. But for the physiological benefits, you don't have to do it 5 days a week. You can still do it twice. The other thing to remember is this, is that some people say, I don't have 150 minutes a week, whether it's twice a week or whether it's 5 days a week. Well, you don't get off the hook that easily. Because then what you can do is you can up your intensity level so that you can go from moderate to vigorous and only do 75 minutes a week, and that produces the same physiological benefits. So obviously this is not for a sedentary person, but you can work towards only getting 75 minutes a week of physical activity to get the maximum health benefits. The problem is that healthcare providers continue to ignore the evidence on this when we're actually doing prescriptions for patients, for us. And we know there's some good reasons for that. That's not a criticism. That's something we need to fix and work on together. And the solution that we're trying to make happen is the Exercise as Medicine initiative, which started off in the United States and we've made global over the last 18 months, which is we want to be in a position quite soon where every time a patient goes to see a physician or other healthcare provider like a nurse, one or two things happens. The healthcare provider gives them a physical activity prescription. That's the first thing that can happen. Now, we recognise physicians have maximum of 20 to 30 seconds, so all we need them to give is the federal physical activity guidelines. Mrs. Smith, I want you to exercise 150 minutes a week, moderate physical activity, and here's what moderate means. That's all you need to tell Mrs. Smith. That's all the physician's got time to do. Or if the physician doesn't want to spend any more time but wants to give more information to the patient, that they refer that patient to a health and fitness professional who can spend the time, just like a dietitian would, working on the nutrition part. A health and fitness professional can spend the time working on the exercise part of it. So one of those two outcomes is what we want to happen. That's what Exercise as Medicine initiative is going towards. One of these two outcomes here. Assessment, and then a prescription or referral. There's some certain things that we're trying to put in place to make this happen. Let me just back up one, sorry. Okay, oops. In order to make this happen, we've got to work with all three groups, and we're trying to do that. We are trying to train healthcare professionals in order to be able to write exercise prescriptions by working with doctors and nurses and other groups that are already in existence to give them continuing medical education to do that, and to try to influence medical school curricula. For example, Cornell have expressed as a desire to work with them on potentially revamping their medical school curriculum for all their medical students to actually integrate this into their medical school. So that's pretty exciting for us. We've got to teach physicians how to do it so they know how to integrate it in part of medical practice. We've then got to teach health and fitness professionals how to work with patients so that they are prepared to receive patients from a doctor, and they know how to work with patients with the most common chronic diseases, and they also know how to talk to physicians and healthcare providers in the language. They need to know all about electronic medical records and all about these other things that healthcare providers, it's routine for them. And then we've got to teach the public. We've all seen these pharmaceutical ads. Ask your doctor if X, Y, Z drug is good for you. Ask your doctor if getting off your butt is good for you. We've got to get the patient So that if the doctors aren't doing it, next time we're encouraging patients. Next time you go in there, next time you see a doctor, ask them about how they can make physical activity a part of the disease prevention and treatment paradigm for you. So all the three things there. If you want to go to exercisesmedicine.org, there's all free resources here, which basically teaches all of those healthcare providers, health and fitness professionals, all the public, a toolkit for teaching how to do the parts that are most important to you. And the physical activity assessment, I'm just going to skip over this, but basically a doctor we really want to ask, they're going to assess your activity level, and they've got a really interested doctor will ask to think about other things like medical readiness, like the trans-theoretical model, motivation to change, which folks like you will probably know. Physicians tell us, yeah, that's all well and good, we don't have time in 20 to 30 seconds, so realistically, we don't expect that. We expect the health and fitness professional to work with this, the allied health professional, to get the referrals from the physicians, and they spend the time changing behaviour. I will tell you here, this is pretty exciting. We have just got, in Kaiser Permanente, at least in California, as of last year, near the end of last year, physical activity is a vital sign. So just like blood pressure, just like weight, every time a physician in the Kaiser Permanente system, the largest HMO in the world, goes to see their physician, they are assessed at their physical activity level. 2 simple questions. About how many days a week do you work out? And about how many minutes a day? Multiplies them up, you can see here, these are the 2 questions. Multiplies the 2 up, and obviously it's trying to get at that federal physical activity guideline, 150 minutes a week. So if the patient reaches that, they don't get flagged, and if they don't reach it, they get flagged as someone who needs some intervention from the healthcare provider. We are working with the other healthcare electronic medical record systems. They've expressed great interest in this to learn about it. We're hopefully not before too long, we'll be in a position where we can have this widely disseminated in as many electronic medical record. I haven't been drinking, it was the Pepsi. You know what I mean, as many systems as possible. Okay, so that's the assessment part of it, that needs to be done, and I'm going to skip over this because this is, and just show you that once they've done the assessment for the prescription, they can basically give the patient, a healthcare provider, allied health professional, gives the patient a simple prescription, and then on the website we've got a list of the 40 most common chronic diseases translated into one-page, consumer-friendly, how to exercise with, and then you have the diseases there which the healthcare provider can give to their patients, and those are freely downloadable as well. So it says, and that gives you the typical things that you would expect to teach your students, what are the contraindications and things like that. As a simple, just to sort of, as we move towards the wrapping up of this, is a simple process. Physicians say, all that stuff is still too complicated. When I said 20 seconds, I really mean 20 seconds. I can't talk about anything else. Okay, doctor, or okay, nurse, or okay, physician's assistant. If you have that little, all you need to think about is the RQ, 7 simple questions, which you can give in the office before you get to the healthcare provider to find out if there's any contraindications to physical activity. And then, if there aren't any, write 150 minutes a week, moderate intensity, and it will describe on the bottom of the pad what the moderate intensity is, which you can print out from the website, and give it to the patient. And then you put refills infinity, and you're done. Because 65% of the people, the survey work said, if my doctor or healthcare provider told me I needed to be physically active, I would do it. 65%. They wouldn't sustain the behaviour change. We haven't done that research, but I bet you they wouldn't sustain that. But just to have 65% of the people admit they'd even try it is a lot better than we're doing now. So we need the health and fitness professionals and the allied health professionals to change the behaviour, but it needs to start there. There's some other resources on the website for either the healthcare providers to give out to their patients or the patients who are at home, professionally produced vignettes of about 6 or 7 minutes each, which tells you what sort of aerobic exercise to do, what sort of intensity should I choose, how long do I need to work out, how can I be flexible? Well, I can't afford to go to a gym. How do I start up a home gym? So there's this sort of resources available to make that happen. And just finishing off here, patients report they do want physical activity from physicians, and physicians do have a responsibility to inform patients, even if the patient does nothing about it. My clinical friends, and I'm not a clinician, tell me that just like if the patient does nothing about smoking, it doesn't matter. You've got an ethical responsibility to tell your patient about the risks of physical inactivity and about what they should do, encourage them to do it, and then the responsibility is truly theirs. So I'm going to stop there and ask if any of you have any questions. And thank you for your attention, and hopefully this is a message that you can make an important influence to pass along to your students, and a difference in their lives, because this is something, unless we do something about in this country, this physical inactivity epidemic and the way it's linked to chronic disease, I mean, is just, it's serious. I mean, it really is, not just health outcomes, but financial outcomes as well. Thank you, everybody.